Welcome to my presentation on aromatherapy for stress reduction. My name is Terrence Shenfield, and I am a respiratory therapist for the last 30 years. I am also an education coordinator for University of Medicine and Dentistry in Newark, New Jersey, and I received a master's degree in complementary and alternative medicine. I believe aromatherapy should be an integral part of the care we give to patients, and this is all coming to light when we think about integrative medicine. The objectives of today's presentation is we're going to talk about what is stress. We're going to speak about what are essential oils. I'm going to talk about methods of administration. I'm going to talk about the limbic system. I'm going to talk about some hospitals that are using aromatherapy currently. I'm going to talk about a technique which is called the M technique. I'm going to back it up with some good studies, talk about diffusers, and I'm going to talk about what essential oils are best for yourself and your patients, and I'm also going to give you a course guideline. When we think about everyday stress, there's not a person on this earth who doesn't have stress. Stress comes in many forms and many reasons. For example, you may be overworked on your job, you may be underpaid, you might be in a bad relationship, your brother may be having problems, your family may be having health problems, you may be having financial problems, you could lose your job. A good friend of mine is in the process of moving right now and he's going crazy. So stress happens every day. How we deal with stress is a different thing. Some people pick up bad habits to deal with stress. They drink, they do drugs. Then there are some good habits you could pick up, such as exercise, eating right, and potentially using aromatherapy to manage your stress. So what is stress? A stressful situation, whether something real like you're about to be attacked or you're diving away from a speeding car, or it can be a looming work deadline, or a psychological stress such as persistent worry about losing your job or a bad relationship. All of this can trigger a cascade of stress hormones that produce well-orchestrated physiologic changes. The same stress response applies to being a patient, new people, new procedures, or hearing a horrible diagnosis. All of this can add stress to your life. A stressful incident can make the heart pound and breathing quicken. It can make muscles tense. It can make beads of sweat appear on your forehead. This combination of reactions to stress is also known as a fight or flight response because it evolves as a survival mechanism, enabling people and other mammals to react quickly to life-threatening situations. The carefully orchestrated yet near instantaneous sequence of hormonal changes and physiologic responses help someone to fight in a threat or to flee in safety. Unfortunately, the body can also overreact to these stresses that are not life-threatening, such as traffic jams, work pressures, and family difficulties. Over the years, researchers have not only learned why these reactions occur, but also have gained insight into long-term chronic effects of stress. Over time, repeated activation of the stress response can take its toll on the body. Research suggests that chronic stress contributes to high blood pressure. It also causes changes in the brain chemistry, leading to anxiety, depression, and addiction. The fight-or-flight response, which is called the SAM pathway, and long-term stress is regulated by the hypothalamic pituitary adrenal axis. It stimulates the pituitary gland to secrete ACTH, and then ACTH further stimulates the adrenal glands to produce cortisol. When cortisol is released into the blood, that even creates more problems. Stress can be both internal and external based upon the situation. Everybody has a different reaction to stress. Some of the symptoms of stress are sweaty palms, changes in sleeping patterns. I could tell you for myself that typically I'm a pretty jovial guy, but at one time in my life I was going through a lot of troubles, and what came out with me was my sleep. I was so stressed that I couldn't sleep at night. So everyone has different reactions. Some people have increased in blood pressures and heart rate. These are the type A personalities who will flip out at the easiest things. Any kind of, someone cuts them off in a car, their blood pressure rises, they flip them the bird, and so on. Some people shake. I've seen some people who were so stressed that they were shaking. Some people got to pee, their bladder goes crazy. And some people get headache, muscle tension. These people sometimes get migraine headaches. So everybody has their own reaction to stress. And the causes of stress are many, and how everyone reacts is different. So the question is, the long-term effects of stress have a certain impact on your body, and actually it's a profound impact. It impacts three main areas: your cardiovascular system, your immune system, and your brain. For example, people who have long-term stress have an increased risk of stroke and heart attack. They are predisposed to hypertension and can have all kinds of cardiovascular issues. On your immune system, people who are stressed actually are more susceptible to infection, and their immune system is really not primed. There's a whole science called psychoneuroimmunology, and they believe that if you're under stress, you will not heal as quickly as someone else who's not under stress. They also believe that if you have positive affirmations in life and you have a good relationship and you have good family support, that your immune system will be more prime. Those who are alone and don't have nobody and are depressed and they have anxiety and so on, and they're under a stressful situation, they don't heal as well. In the brain, stress hormones affect memory. For example, long-term stress on the brain can result in anxiety, insomnia, and depression. I'm a pretty normal guy for myself, I like to think. Yet if I go under stressful situations, it comes right out on me in insomnia. I don't sleep very well. So I try to manage my sleep, and I try to manage my stress, and I try to manage my life. So you, like many other people, are feeling stressed. The question is, what can you do about it? You could do some unhealthy habits such as drinking or doing drugs, or you could find some good ways, healthy ways of doing things. And some of the choices are meditation, yoga, write a journal, do something you like I love to ski. I actually enjoy going out every winter and skiing. I feel like really good when I do it. I feel like the only pressure I have is just surviving down the mountain. You could do meditation. People do various forms of meditation, but meditation has been known to calm you. You could do some exercise like yoga. Some cases, some people write journals. Journalism is a science where, suppose you were really pissed off at somebody, so you decide to write down on a piece of paper what you want to do to that person, which we won't get into. But then just before you decide to do that to the person, you rip up the journal. The idea is that you purged all your feelings, all your hostilities out on that piece of paper, but you destroyed the paper before you do anything harmful. Another good source is guided imagery. Guided imagery is putting yourself in a place that you feel most comfortable. So you close your eyes, you take some deep breaths, and just imagine a happy time. But for our purposes, we're going to talk about aromatherapy, which is a great tool to relieve stress. You may be wondering, where does aromatherapy oils come from? Another name for aromatherapy oils is called essential oils. Essential oils are not in every plant on the planet. Certain plants are called aromatic plants, and these particular plants contain the essential oils. The oils found in the same plant, for example, lavender. Lavender has flowers, it has a root, it has a stem, and it has leaves. The chemical components of the lavender plant for each of those systems may be different, so you only use special oils from certain parts of the plant. For example, ginger root is actually only from the root of the plant. Typically, they're extracted by a system called steam distillation and also cold press distillation. What that means is that they put the flowers or the stems or the leaves on this boiling pot of water, and I'm talking about big vats, and it creates a steam, and the steam actually lifts the different chemical components out of the plant, and then it's processed to cool off, almost like a moonshine machine. These oils are very highly concentrated, and they're far more concentrated than dry herbs. So you might get some dry oregano leaves, but that has nothing to do with oregano oil, which are much more complex. These molecules are very complex, and I'm going to tell you a little bit about how complex they are in the next slide. To demonstrate how complex these essential oils are, I want to do a comparison of Western medicine versus Eastern medicine. And let's take, for example, Camellia sinensis. Camellia sinensis is known as tea, green tea. From a Western point of view, they use the green tea to synthesize caffeine from the leaves. So in other words, Western medicine has one value for Camellia sinensis, which is basically to get the caffeine, which is only one quality to caffeine. It's a stimulant. Where in aromatherapy, Camellia sinensis has many qualities. It's antibacterial, antioxidant, anti-inflammatory. Another example is the poppy plant. From Western medicine, they get morphine from the poppy plant. And they also get codeine, which is used as a pain reliever. But from a Eastern point of view, that same plant could treat cancer tumors, constipation, insomnia. And the same thing goes for digitalis. Digitalis is typically used for cardiac conditions, but the plant itself, from essential oil point of view, is used for eternal hemorrhages, inflammatory disease, and delirium. So you could see how essential oils have more wide scope uses versus Western medicine. So what exactly is the function of essential oils in plants? Plants, unlike animals, are stationary, meaning they grow roots in the ground. So unlike animals and us, if we feel any kind of danger or threat, we could run and move away. We could even fight back. But plants really can't do that. They are in the ground, and so what they do is produce natural immunities. And this natural immunities comes in the form of essential oils. So essential oils are used for various reasons in a plant. Number one, they attract animals and insects for pollination. This ensures the continued growth of that species. Another thing is when plants secrete essential oils, it protects them from bacterial infection, fungal infections, and other microorganisms. That is why when we use essential oils on humans, it fights off certain bacteria. Actually, they've been using certain types of essential oils to fight off MRSA, because the plants produce these essential oils to fight off microorganisms for its own self. When we apply it to ourselves, it works very well. It's also a very powerful antioxidant to the plant, and one of the biggest things it does, it actually repels predators. So when plants secrete essential oils, some of the predators that would normally eat it are repelled by the smell of it. So that's the reason why plants produce essential oils. You're going to love this homemade DEET recipe, which is all natural. Basically, you take 2 ounces of distilled boiled water, you take 30 drops of citronella oil, 25 drops of peppermint oil, 15 drops of tea tree oil, you take 1.5 ounces of vodka, you swig it down, no joking, you put the 1.5 ounces of vodka into the mix, you mix it all together, and now you got yourself homemade insect repellent spray, and it's all natural. So exactly how do essential oils work on the body? There are 3 ways: pharmacologically, physiologically, and psychologically. I seem to buy into the pharmacological method. For example, I've been an education coordinator for the last 30 years of my life, so I buy into how certain drugs attach to receptor sites in the body and then elicit some kind of physiologic response. So when we inhale an essential oil, or if we absorb an essential oil through our skin, they attach to the cell membrane of our cells, and this elicits some kind of physiologic response. This works just the way any other drug would work. For example, a beta agonist like albuterol. You inhale it, it attaches to the cells, and it gives bronchodilation. So my theory on how it works is through a pharmacological aspect. And also this implicitly means that you're going to get some kind of physiologic response because it attaches to the receptor site. From a psychological point of view, sometimes if you worked all day and you come home to your house and you smell this delicious gravy on the stove, your mouth can water. And, this can just bring back memories of your mother's cooking or anything like that. So the modes of essential oil are various, but I seem to buy into the pharmacological and the physiological aspect more than I'd buy into the psychological aspect, but that's just my opinion. The methods of administration for essential oils is various. For example, in France, they actually ingest essential oils. A physician will order an essential oil for a patient where they would take 2 or 3 drops in a glass of water and would take that 3 times a day. You could also take tea tree oil and put it on a tampon for yeast infections. That's another way. You could inhale it. You could inhale it by the fact of using a vaporizer. And you could also, by the sense of smell, you could put a couple of drops on your pillow and you could smell it. And you could also use it topically. A lot of people use essential oils as a topical application, meaning they do it with massage and it's absorbed through the skin. And I'll get a little bit more into each one as we go along. Let's talk about the oral administration of essential oils. In the United States, typically they do not take essential oils orally, but in France, they are the forerunner. They actually have so much experience with essential oils that the physicians, the MDs, actually prescribe essential oils for a variety of conditions. For example, if a patient comes in and they have pneumonia, they may suggest to use oregano oil, 3 drops 3 times a day in water. The French incorporate this tool called aromatogram. Aromatogram is just like a culture and sensitivity plate. So basically, you would put a blood sample or a sputum sample in this petri dish, and then you would put different essential oils on the infection, and you see which type of essential oil works best. Typical dosage is anywhere from 3 to 20 drops a day. But you got to be very careful about adulteration. Adulteration is when you have an oil that smells like an essential oil that but it's really not. It's chemically made in a laboratory, and some unscrupulous people do it that way. As I was telling you on the last slide, the French incorporate this thing called aromatogram, and basically the goal is to determine what kind of essential oil would work best for a particular infection. The godfather of aromatherapy, his name is René Maurice Gadaface, and he actually was a chemist, and he did so much research on essential oils, and he found it worked very well for burns and pain and infection. Some of the most common essential oils that are used for infection are lemongrass, oregano, savory, red thyme, cinnamon. These are the best antibacterial type of essential oils that could be on the market. Also, sometimes you have multi-resistant organisms, and these type of oils can work better than antibiotics, and there's some new research coming out on that. This picture says 1,000 words. I don't know about you, but I grew up in an era where if I had some kind of nasal cold or I needed some decongestion, my mom would put a big pail of water, hot water, and put some Vicks in there and put a towel over my head, and I would inhale it, and my eyes were running like crazy, but let me tell you, my nose cleared right up. So this is one way you can use essential oils for inhalation. For example, eucalyptus oil is being used for clears the mind and focus. It actually reduces swelling in the mucous membranes, and it actually is a great tool to use if you have a sinus infection or you have nasal congestion. Great tool. Let's talk about the anatomy and physiology of smell. Many of us take smell, our sense of smell, for granted. We don't use it much as a survival mechanism unless we smell some rotten food or we smell some good food being cooked on the stove. Then it has some kind of response to us. Like taste, the sense of smell is responsive to chemical stimuli. There's the olfactory receptor neurons, which is a small cluster of neurons located in the superior nasal cavity. This region is referred to as olfactory epithelium. Each olfactory sensory neuron has dendrites that extend into the apical surface of the epithelium into the mucous lining of the cavity. As airborne molecules are inhaled through the nose, they pass over the olfactory epithelial region and dissolve into the mucus. These odorant molecules bind to proteins that keep them dissolved in the mucus and helps transport them to the olfactory dendrites. The axon of the olfactory neuron extends from the basal surface of the epithelium through the olfactory foramen into the brain. So there's a direct connection between the neuron in the nose to the brain. The group of axons called the olfactory tract connect to the olfactory bulb on the ventral surface of the frontal lobe. From there, the axons split and travel to several other brain regions. Some travel to the cerebrum, some travel to the olfactory cortex, and some travel to the temporal lobe. Others project into structures within the limbic system and the hypothalamus, which is associated with long-term memory and emotional response. The fact that the sense of smell is linked to the limbic system and the hypothalamus makes it recognize that we can remember long-term memories and emotional responses from the sense of smell. So that's how it sort of works, and I'm going to get a little bit more into the concept of the limbic system. The limbic system and the sense of smell are intricately related. When you think of the limbic system, you got to think of the primitive brain. This is one of the basic parts of the brain. It is actually a very, very important part of the brain that's involved with emotions and memory. Motivation, learning, memory, all of these things are part of the limbic system. It's also part of our survival process, how we survive. We need some basic instincts. It actually registers some basic emotions such as pleasure, pain, fear, anger, and sexual feelings. The point which I'm making is that essential oils have a direct impact on the limbic system, which impacts so many different parts of our brain, especially in regard to emotions, and that's where essential oils can have a very powerful response. I'm going to finish up and tell you the final slide on the transmission of smell signals in the CNS. Remember, the sense of smell and the molecules that come into the nose go into the olfactory receptor neurons. They in turn go to the olfactory bulb, and from the olfactory bulb they reach different parts of the brain, the frontal cortex, the hypothalamus, and the hippocampus. What that means that each of these portions of the brain have a different type of response, such as the hypothalamus amygdala has a lot to do with emotions and motivation, where the hippocampus has a lot to do with memory, especially odor memory. And the frontal cortex is all about consciousness and perception. So essential oils have a very powerful impact on various parts of the brain. Let's talk about the topical application of essential oils. It's specifically with the use of massage. A lot of times what they do is they take an essential oil, they mix it with a carrier oil, and then they massage it on different parts of the body. When you use the massage technique, it is actually absorbed through the skin, such as a fentanyl patch. It has direct and indirect physiologic and psychological effects as is absorbed through the skin. The concept is when you get a massage and you get a massage with an essential oil, it really does reduce the stress level. They have done many studies where they have done massages with, say, sesame oil or coconut oil with no essential oil. Then they added essential oil, and the impact is really profound. It actually improves blood flow and lymphatic drainage. It stimulates the parasympathetic nervous system, and we all know that the parasympathetic nervous system is part of the healing processes of the body. Also, there's a psychological effect of touch therapy. For example, if we're under stress and someone comes over and someone you know and you trust puts their hands on your shoulder and say things will get better, you do calm down. Your respiratory rate calms down, your blood pressure calms down. So there's a real psychological and physiological effect when you touch someone. So especially with you getting a massage with an essential oil, it has a profound parasympathetic response. Because I'm from East Stroudsburg, Pennsylvania, and very close to New Jersey and New York, I'm only 90 minutes out of New York, I thought I would list some of the hospitals within our area that are using essential oils as part of their therapy for patients. For example, many hospitals use it in the emergency room to sort of reduce the stress. Some dental offices use it just to reduce the stress of patients who are going under a dental procedure. So some hospitals like Beth Israel has one in New York, Columbia Presbyterian, New York, Elk Regional Health Hospital in Pennsylvania, Englewood Hospital in Englewood, New Jersey, Memorial Sloan Kettering Cancer Center in New York, one of the top cancer centers in the world, St. Barnabas Healthcare System, which is a huge system in New Jersey, and Valley Hospital. I like to say kudos to Valley Hospital because they have a very sophisticated program for the use of essential oils, and they actually have their nurses and some other staff go to training specifically to understand how to use essential oils. If you don't know much about aromatherapy or essential oils and you're a healthcare practitioner, I would suggest one of the first books you should get is a book by R.J. Buckle. R.J. Buckle is a nurse. She's a PhD, and she's really a pioneer in the use of essential oils, especially evidence-based essential oils. Now, I know that we're all busy, and can you imagine in a hospital now that part of our therapy is that we start giving essential oils to patients as a local massage? This could be done by a nurse's aide or any other skilled person. So R.J. Buckle developed this technique called the M technique. And basically it's a patented technique which only takes about 5 minutes, where you massage the hands in a special method. I would suggest that if you really want to know how to use this method, and it could be used at home too if you wanted to do some self-care on yourself or family member, this is a great tool. It does relax you tremendously. It's called the M technique, and if you ever go to Google or you go to YouTube and you type in the M technique by R.J. Buckle, you'll get plenty of hits on it. But I strongly recommend you try it. The M technique, there's a couple of images that you could see. It could be done on the hand. It could be done on the forehead. It doesn't take much time, but it has proven results. And R.J. Buckle is the one who patented this method. And I think it would be to your benefit to really look at it and see how it works. As I told you before, the M technique is on YouTube, and this is a title of a presentation. It's called the Hand M Technique, and it was demonstrated by Beatrix Veal, and if you go to YouTube, I believe you'll find it. I've been in the health field for over 30 years, and I've been an educator in health medicine for the last 30 years too. Because of my training and because of my biases, I'm always looking for randomized controlled trials. I don't believe in hocus pocus. I believe in randomized controlled trials. I believe in having positive outcomes, and I don't believe too much in testimonials. I'm more about like, where's the evidence, where's the evidence, where's the evidence. So I wanted to show you a few studies that I looked up that looked at the use of aromatherapy, massage, and for different types of conditions in the body. And I think you'll find this very useful. And I don't know how you feel, but I'm a little bit like, where's the evidence? Where's the evidence? Where's the evidence? So let's start off with a study, and the study is titled Reducing the Symptoms of Lymphoedema. Is there a role for aromatherapy? It was a randomized controlled trial, and it was based from 2006. And basically what they did is they did a massage on a patient, and one massage contained a carrier oil, which is like coconut oil, and the second massage contained coconut oil with, in this case, lavender oil. So it's a comparison. It's a comparison of a massage on a patient, one with essential oil of lavender and say a carrier oil, and the next one was just a carrier oil. And they found that there was an increase in patient identified symptom relief and improved well-being with the use of an essential oil rather than just the carrier oil. And I'll explain a little bit more what a carrier oil as we go along. The second study I want to tell you about is called The Effects of Aromatherapy Hand Massage on Pain, State of Anxiety and Depression in Hospice Patients with Terminal Cancer. Again, this was a randomized controlled trial. It was from 2008. And basically, they did the same thing. They did a hand massage with a patient who had just a regular oil like coconut oil, which is not an essential oil, and then they did coconut oil with a mix of different types of essential oils. In this case, it was a mixture of bergamot, lavender, and frankincense. So they gave a 5-minute hand massage for 7 days. One hand massage was given to a group with just carrier oil like coconut oil, and the other one was coconut oil and bergamot, lavender, and frankincense. And what they found was when they looked at the outcome, the aromatherapy hand massage had a better relief in pain reduction and depression on a scaled survey. So again, this showed a very positive outcome for the use of essential oils. This is an older study from 2001, but again, it's still good. This spoke about the role of aromatherapy massage in reducing anxiety in patients with malignant brain tumors. It was from 2001. Again, it was a randomized controlled trial. And again, they did the intervention of aromatherapy massage, and then they did another study versus just the carrier oil. So one group received a aromatherapy massage with an essential oil, and they also played Enya music for 30 minutes, and the oils they used was lavender or Roman chamomile, where the other one was just a carrier oil like coconut oil or sesame oil. And the outcome of this study showed a decrease in systolic and diastolic blood pressure. Also was a decrease in heart rate, decrease in respiratory rate. And 1 week later, the patients felt more relaxed and less tense compared to the control group. So again, this is a positive study how the use of essential oils can benefit a patient with a simple massage. Another study I'm going to talk about is from 1999. Again, it's a randomized controlled trial, and the title of this was An Evaluation of Aromatherapy Massage and Palliative Care, which is so important. Palliative care is more and more common. Hospice patient is more and more common. So what they did was they, again, used a carrier oil, which an example of a carrier oil could be sesame oil or coconut oil or any oil, but not an essential oil. And then they did aromatherapy massage, which contained Roman chamomile oil. So they gave sessions for 3 weeks, and the outcome of this was the massage with or without essential oils reduced the level of anxiety. There was improved physical and psychological symptoms on a survey sample with the ones using essential oils, and there was an overall improvement in the quality of life of these patients. So again, very important outcomes. Let's talk about the delivery of essential oils with what they call vaporizing diffusers. The image you see on your screen is basically you plug this device in, you put about a half cup of water in the base, you put about 7 to 10 drops of an essential oil, you plug it in, and then what happens is it creates this mist that you see, and it smells wonderful. This device costs about $30. Now, because I'm a respiratory therapist and I know a lot about particle size of nebulized solutions, when you could see this cloud of mist from the essential oils, and you see the way it's dropping down, like it comes up in the air and then it drops down, that means that the particles in there actually are so heavy, they're so thick, and that they actually make the solution of essential oil, and within a 3-foot radius of that device, they drop down. And this is very good for a dental's office, but this is not the best choice for you at home. This device costs about $30, but because the particle size of the essential oils are dropped down within a 3-foot radius of the device, you really don't get a chance to inhale these particles to get any kind of benefit from them. Let me show you the next device. The next device is called an Atomized Diffuser. And basically, I have this one. And any of you have heard of the Aroneb piezoelectric nebulizer? It works on the same principle. The difference with this device is that you don't put water in it. You fill it with a little bit of essential oil and you turn it on. And this vibrates at such a high frequency that the particle size are so small you don't even see them. So the benefit of this is the particle size are so small and they're sent into the air, and they actually fill in the air within more than a 3-foot radius. It probably would fill in the whole room. All depends on the size of the room. The benefit of this is that first of all, you could smell the essential oils, and second of all, you can inhale some of the essential oils, and say particularly lavender, which is good for helping you sleep and helping reduce stress. So you could turn this on, turn it on, and you won't even see the oils going up because the particle size is so small and it's so effective at working. This device costs about $90. Another method of doing it is called compresses. Now, I'm sure you might have heard of wet compresses, cold and warm. Years ago, if I got some kind of infection, my mother used to take this little, little plate of water, and we'd warm water, and she would just soak a wound with a warm cloth, and it actually worked very well. So there's 2 types. One is called cold and one is called warm. The concept is the same. If you wanted to use a cold compress or warm compress, basically you take 1 cup of water with 5 to 10 drops of an essential oil. Suppose you have a headache. You could take 3-4 drops of lavender oil with 1 cup of water and inhale it. Or if you have a sinus headache, meaning you have inflammation in your sinuses, you could do 3 or 4 drops of lavender and peppermint oil, and this works wonderful. In regard to topical infections on your skin, you could do the same thing, with basically about 5 drops to 10 drops of thyme or oregano oil in 1 cup of water, and you could put that compost right on your skin, and it works very well, very well. Now, earlier I was kept on telling you about those randomized controlled trials where they were using a carrier oil or they were using a carrier oil with an essential oil. Typically, essential oils are never put on the skin or inhaled when they are without being diluted. So the concept of dilution is that you would take a few drops of essential oil and you mix it what they call a carrier oil. Different types of carrier oil is coconut oil, grapeseed oil, or olive oil. And there are other carrier oils too. There's a whole list of them. So a carrier oil is different than an essential oil. So you got to realize that. And most essential oils, you always mix it with a carrier oil. I personally use coconut oil because it's basically odorless and it doesn't stain any kind of your clothes or the sheets, when you go to sleep. So I prefer that myself. This is a very important chart because it talks about the dilution. Like I told you before, you don't use essential oils pure. You always mix them with a carrier oil. So typically, most people use anywhere from a 5% dilution to a 10% dilution, and I'll tell you what I mean by that. For example, if you're going to do a massage with lavender oil and coconut oil, you may want to have a 10% dilution. I find using 9 cc's of carrier oil, 1 cc of lavender oil gives me a 10% dilution. I would suggest if you're using essential oils for the first time, you use anywhere from you start with a 2.5% dilution. So basically you would take 1 fluid ounce of carrier oil and 15 drops of your essential oil, and that would do it. I sort of like that 10% factor because I have the ability to measure up 9 cc's of carrier oil and I put 1 cc of the essential oil, and it works very well for me. Your choice. So this particular lecture, there's many topics that I could do on aromatherapy, but I was talking about reducing stress, and I'm talking about managing the stress you have on the job and at home. So these particular oils are the best for reducing stress. Bergamot, chamomile roman, jasmine, lavender, to name a few, and I have some more coming up. When you buy essential oils, make sure when you buy bergamot oil or you buy lavender oil, you look for it by the Latin name. For example, lavender is Lavandula augustifolia. So when you buy essential oils, make sure you use the Latin name. And the reason for that, there are different types of lavender. There's spike lavender, there's English lavender, there's regular lavender, and sometimes each of them will have different types of effects. So remember, when you buy essential oils, buy them by the Latin name, and the Latin names I'm listing here. Bergamot, antidepressant, calming, relaxing. Lavender is the least expensive of all these oils, and it has so many good qualities about it, and there's so much research on it. I personally use bergamot and lavender. I love the smell of jasmine too, but I can't afford it. So let me complete the list of additional essential oils used for stress. Again, don't forget, whenever you get anything, you buy it by the Latin name, and you can see the names right there. For example, rose oil. Rose oil is a wonderful, very good oil. It's an aphrodisiac, it's antidepressant, it's relaxing, it's soothing, but it's very expensive. Neroli oil, orange blossom, is wonderful smelling. I mean, all of these oils are wonderful, but they all have a different price tag, and I'm going to get a little bit more into that. So it all depends on your budget. So when I put this price tag together, I looked at various prices. Bergamot, $33 an ounce. Chamomile roman, $74. Jasmine, $169. Lavender, $19 an ounce. Rose oil, $574 an ounce. Let me just say something. Sometimes there are some very good vendors out there that you could buy essential oils from, but some people are a little bit crooked. So when you talk about rose oil, sometimes these unscrupulous people will use a mixer, like they'll dissolve real rose oil with another type of chemical that smells wonderful, that you might think is rose oil, but it's really not. Because lavender is so inexpensive, the likelihood they're going to dilute that with anything else but lavender oil is very, very low. So on a personal note, I like bergamot, I like lavender, and I'll tell you a little bit more about that as we move along. Like I was saying, lavender, rose, neroli, chamomile are the most commonly used oils in studies. Rose and eucalyptus combination have been reported to be uplifting and decrease cross-infection rates. Lavender really is the most well-studied essential oil out there. It's so effective, it's so inexpensive, the likelihood of anyone diluting that with anything else but pure lavender oil is very, very low, and it really seems to fit the budget. I'm not taking it away from any of the other oils because each of them have their own quality, and this particular lecture we're doing today really only speaks to the fact about stress reduction. In summary, I'm hope that you have a deeper understanding of essential oils. I know this topic is strictly about the stress management and the use of essential oils, so you really got to manage stress. Stress does kill. All of us are under certain stress levels. They got new studies coming out each and every day. It's funny that the Middle East, like Iran and Iraq, have most of the most valid studies coming out. They really use a lot of these essential oils. They work very well when you apply them with a gentle massage, and the M technique is something you might want to consider. There's something very important, like, today's day and age, we're gowned up, we got gloves, we got this, we got masks, so you don't ever touch anyone. And I know we don't like touching our patients, except if we have to deliver something to them or we have to do a diagnostic procedure. But, this seems to be missing in healthcare. And if you can't apply it to the patient, apply it to yourself and apply it to your loved ones, because this is a very good strategy. And be kind to yourself. And I want to thank you very much for joining me. I'm listing some very good references for you. If you wanted to really understand a little bit more about aromatherapy, these are great. And if you really want to get down into it and look at the randomized controlled trials, remember I was telling you about R.J. Buckle, and she's Buckle J from 2015, Aromatherapy for Stress in Patients and Hospital Staff. This is something that could really benefit you and your family, and especially the patients.